Malaria continues to be a formidable enemy in Kenya, where it heavily impacts on the most vulnerable people in spite of decades-long intense efforts to combat it. Experts and medical professionals highlight the several obstacles that are causing it to spread, such as environmental causes and poor access to healthcare. Furthermore, Kisumu County is recognized as a malaria hotspot, which leads to the request for more financing in order to meet the challenging objective of eliminating malaria. Anodida reports.
Malaria, transmitted through the bite of infected mosquitoes, has long plagued Kenya with devastating consequences for its communities. Despite progress, the disease remains a significant public health concern, particularly affecting vulnerable populations such as children and pregnant women.
When a mother is pregnant, the malaria parasites tend to go and embed into the placenta. They go and attach into the placenta of the growing baby, and then it gets very, very difficult to treat.
Limited access to healthcare, inadequate funding, and environmental factors continue to fuel the spread of malaria in Kenya, but the impact goes beyond health, hindering economic development and perpetuating cycles of poverty.
If diagnostics, we use about 4 million diagnostics per year for malaria. That's a lot of money, and our diagnostics minimum is 300 shillings.
And as the world celebrates World Malaria Day, efforts to combat malaria continue, with organizations in Kenya implementing a range of prevention and control measures, from distributing insecticide-treated bed nets to educating communities on prevention methods, initiatives that are making a difference in communities that are most affected.
We've found out that we can fight malaria as a collective. But if there is no individual responsibility, then we will not be able to achieve zero malaria in the country.
The Zero Malaria Campaign Coalition, under the initiative Down the Power of Everyone campaign, seeks to give every Kenyan the opportunity to play their part in the national goal of zero malaria and ending the deadly disease for good.
Yes, the interventions are there. We've gotten a lot of support from the Global Fund and other financiers as far as resources is concerned. But how are we utilizing these resources?
Amidst the grim statistics of Kisumu County being on the hotspots of malaria spread are the voices of those directly impacted by it. Their stories shed light on the human toll of the disease and underscore the importance of collective action.
We usually have so many cases of malaria, and it's because of, I think, the lake around, plus how we live in our environments at home.
Na ukienda kwenye vituo vya hospitali ama kwenye kliniki unapata madawa haipo.
Kenya's dedication to eradicating malaria is evident through its outlined strategic objectives in the Kenya Malaria Strategy for the period of 2019 to 2023. The plan aims not only to alleviate the burden of malaria within the country, but also to contribute to the global aspiration of eliminating malaria by 2030. The objective of the KMS revolve around safeguarding vulnerable populations, effectively managing malaria cases, promoting the utilization of interventions, and bolstering surveillance mechanisms. Anodida, TV 47.